Hey everyone, welcome to another episode of Darshan Talks. You've probably been hearing from me a lot nowadays, so sorry about that. But we're going to continue our conversation with Angela Wagner on issues relating to trust. And we're going to talk about why there's been a breakdown between pharma and patients and the trust between them, and the type of research that Angela is doing to evaluate what works in establishing trust between those two parties. So, Angela, you want to first introduce yourself and then tell us more about where we are in terms of a recap.
Sure thing. Well, my name is Angela Wagner, and I'm a full-time student in the Master of Science in Biomedical Writing program at University of the Sciences. And Darshan is sort of helping me out with my senior capstone or my master's capstone project, which has to do with the nature of trust between patients and pharmaceutical companies. And it's actually been really an interesting project. It's something that we're trying to kind of crowdsource in that, we're making it available for people to comment on it, to, make it the best paper we can. And it's really exciting that we can kind of do this in real time. And incidentally, if you wanted to look at the outline and comment on the outline, anyone who has the link can comment. The link is, there it is, tinyurl.com/model of trust. So I'll go briefly into the basics of the model. The model
Just out of curiosity, by the way, Angela, has anyone commented yet?
No one has commented yet.
I just want you to know that people, Angela was looking forward to you guys commenting. She now feels left out.
Oh, much sadness, but I'll try to rally. Well, after you see tonight's presentation, you'll be so excited that you'll just be like, I would love to comment. I just need to comment. You did it so wrong. I have to comment. That's okay. That's okay. It's fine. Anyway, so the model of trust relies on empirical research that was done in the last 10 years. So nothing older than 10 years. It needs to be human-based research. It can be from it can be like a clinical type study. It can be a psychology study, and I've actually got a pretty interesting mix of different things going on to support the model. But basically, in a nutshell, the model has 4 pieces. The first is benevolence, which is roughly the same as altruism, as far as I'm concerned. It has to do with things that are value added, that cannot be of direct benefit to the pharmaceutical company, and they may harm, depending on what it is, but always value added, never direct benefit. The second piece is attunement, and that actually does not have to be value added. Attunement involves 3 sort of subsections. They are awareness, response, and harmony. And I don't want to get into those too much right now, but basically it works out to be sort of a 2-way street. So it isn't necessarily direct real-time communication between the parties, because that obviously could be kind of challenging, but it does represent there being a 2-way movement of ideas and an aligning of goals. So that's kind of a different one, but I'm happy with it, actually. The third piece is integrity. That it's fairly straightforward. Integrity just has to do with the pharmaceutical company seeming to be incorruptible. Let me look really quickly at my notes here, see if there was anything else that I wanted to add. Oh, there were specific measures for integrity that are just for written materials, and I found that very interesting that people had actually studied integrity as it related to materials, written materials. So that came in very handy for my my project. And the fourth piece is competence, which has to do with not only the pharmaceutical company having advanced knowledge and the patient realizing the pharmaceutical company has advanced knowledge, but also that the pharmaceutical company is communicating that knowledge in a way that the patient can assimilate it without undue effort. So easy to understand, seems to make sense. And that, can sometimes be a challenge because the patient audience is not, one person or one type of person. It is many types of people. So can be challenging. All right, so tonight's big topic is going to be having to do with methodology. We were going to back it up a little bit from the last session and sort of talk again about the use of keywords and developing a keyword list. But this,
Angela, before you jump into that, what are we measuring? What are we trying to test?
What are we measuring? Well, we are trying to measure, first of all, measure, is there trust or distrust or lack of trust? Because in this model, trust and distrust are separate, but I don't want to get into distrust too much because I think it muddies the water. We want to see if there's a general patient positive or negative sentiment, trust or lack of trust or distrust in particular brands that I have chosen based on marketing, on ad spend reports that I've seen. So we're looking to see what is the patient sentiment. And then we're going to take that and examine the brand websites, the patient-facing websites of these brands to see how the written materials correspond to the trust model. And that's important because, as a medical writer, written information is kind of important to me. And so that is really what I'm focusing on. But this model is not necessarily specific to medical writing. I think it could have a lot of different applications.
Very cool. Just out of curiosity, what kind of applications did you have in mind?
Well, what I would really love to see is, various human studies to try and test this model. So you could go with a web-based human study where it's sort of a user experience test. You could do, a survey, although surveys are kind of boring. I think a social media campaign would be interesting. I've seen where those have been done to test various theories using patient or general public, specifically for healthcare. So that was kind of fun too. And there are just a lot of other things that could probably be done with it. It's not specific to written material, but it includes written material.
Right. Very cool. Please continue.
Okay, so let's see. We were discussing, the methodology. So today, the little piece that I'm going to discuss is going to be the Twitter API. And it actually is not as complicated as it sounds. So we'll go over that quickly. And obviously, if anyone has a comment, or if you think, why is this necessary? Maybe there's a better way. I would love to hear it. I've been working on this for a while, and sometimes we get tunnel vision. So comments are welcome. Now, initially, I was going to back up and discuss my keyword selection from last time, but actually with this being a living document, I decided to just get rid of the keywords. I discovered we could do the same thing, actually, just doing a sentiment analysis of the Twitter information. So let's move right into it. Let's see, do I need to discuss the list of brands again, Darshan, or do you think we're...
No, just that we're a bunch of brands. I think we can say that.
Okay.
Yeah.
Bunch of brands.
Just a recap,
Yep.
Yeah.
A lot of them are actually, there's a lot of therapeutic biologics in the list, but it's not all therapeutic biologics. So, we're looking at drugs that are getting a lot of ad spend recently. Some are a little newer, some are a little older. None, as far as I can tell, have a generic that is being marketed in the US, or obviously an interchangeable biosimilar, because as far as I know, there still aren't any. And really what I'm looking for here is if there's a brand mention, I want to make sure it's talking about that particular product. So, if there is a generic, it has been shown that people will refer to the generic as the brand name. They see the two as being the same, and that didn't help my purposes. So had to be things that did not have a marketed generic in the US as of, this month. All right, what I'm going to do now, instead of immediately bringing people into the outline, which is, it's a little dry. Actually, you know what? I will go ahead and go through the outline very quickly, and then we'll kind of skip over to the slides. So I wanted to talk about why I wanted to use Twitter. So I looked up Pew research that had to do with social media being used. And it turns out Facebook, Instagram, and Twitter are all widely used. So I thought, okay, well, I could use Facebook, I could use Instagram, I could use Twitter. I wanted to do all three, of course. I mean, who doesn't, right? There was a 2018 analysis from Ogilvy Health that found Facebook was actually getting the most customer engagement. for Pharma, followed by Instagram and then Twitter. So now I thought, well, definitely Facebook and maybe possibly Twitter. Well, it turns out that the Facebook and Instagram information is difficult for me to get. It's available through something called CrowdTangle. But priority is given to PhD researchers, post-grad researchers, and faculty, which I am actually none of those. So, it didn't put me at the top of the list. And incidentally, I discovered that one CrowdTangle data set is available through socialscience.one, which I believe is through Harvard. But it actually does not include the full text search. And what I really needed to do is a sentiment analysis on a full text, because there do not seem to be any fields related to trust for any of these social media platforms. There's nothing that says, yes, this is trusting. There's no algorithm that's built in that will tell you about the trust for this particular, for a brand mention, let's say. As far as I am aware, there isn't anything in the platform itself, or that the API can pull. So that made it a little more difficult. And that was actually applicable to both Facebook and Instagram. But the good news is that Twitter offers a basic developer account for free. It's available to me. It meets the needs of my project in that you can, in fact, do a full text poll. So Twitter it is. All right, now I'm going to switch into my slide deck real quick. And in order to do that, I'm going to stop sharing, Darshan, and then I'm going to share again. And I believe this is it right here. Can we see it?
We can.
All right, so I did an example. I pulled a sample one, and it was for Jardiance. And you can see on the screen, this is the API call, and API is, just a second here. Wanted to bring this up along with it. Oh, wait, you can't see it. Well, when you can see it again, it'll be on the right screen. So an API is called an application programming interface. Basically, it's a way that you can send a query or a question and receive a response. And when it goes out, it's called a call. So basically, in order to use Twitter to get the information I need, I have to create a query, which is the first one here, and it's URL encoded, so you can't see where the spaces are and whatnot. But if you look at the bottom, I've converted it to standard English. So basically, it's saying, here is the Twitter URL that I'm looking at. I'm looking for Jardiance or hashtag Jardiance. I want it to be in English. And it was for a 7-day period of 1/3 through 1/10, maximum of 100 tweets, and do not truncate. And that's important because if you truncate, you will not get a full text response. Now, the maximum for the free developer account is 100 tweets at a time for a 7-day period. So, if you want a lot of data, you would need to pull every 7 days. And I've actually only pulled once because I was just sort of a test. So certainly I can.
Is this for the test or is this for the actual study that you're doing this?
Well, this was for the test, but it seemed to work well. So I can't see why it would not be useful in the actual study.
I'm just wondering whether it's going to add bias when you're choosing 100 tweets in a 7-day range.
Okay. Well, as compared to.
Well, the idea being that maybe something unique happened. For example, you're measuring during COVID when they're saying that the trust is higher. Is that going to bias things as opposed to going back, say, 2 years?
Well, I mean, that is a good point. But I mean, this was all I had available. And I was kind of disappointed that I couldn't get the historical data because I thought it would be interesting to go back, say, to 2019.
Right.
And then come forward and see. But, in looking at the data that it pulled, I'm not sure that it made a difference. There were almost no mentions of COVID. There were a couple. I didn't want to exclude them, but I didn't want to, focus on them either. So really what I'm going for in this case is sort of a snapshot. I want a snapshot of what is the consumer sentiment toward Jardiance? What are people saying about it on Twitter? And how can I figure out whether that is trusting or distrusting or neither? And it worked out okay. So yeah, I mean, it could certainly add bias. There are a number of things. In fact, there was one that I pulled as a test and discovered that there had been something in another country where the one of the politicians had left, a few different drugs off a national formulary list or a proposed formulary list. And, it kind of blew up everything, and it really did use up a lot of my 100. So maybe pulling a couple of times, or 3 times, maybe 4 times. How many pulls do I need to make sure that I've sort of evened things out? But again, it's supposed to be a snapshot. So
well, I think considering you're doing a snapshot, you just need to make sure that if you're doing any other pulls against any other sort of social media mechanism, you're doing it at the same periods.
Right. Yeah, all the brands have to be pulled simultaneously. Well, correct. I mean, you have to go in and change the brand name in the query and then run it again.
Right.
But they all need to be run in the same day. Otherwise, that would be worst even.
Yeah.
So yeah, definitely trying to make sure it's as nice and neat and unbiased as possible. So all right, this is slide 1. So you can see this is what we start with, is the API call. And then it creates a JSON file. And I'm trying to remember JSON. It's JavaScript object, oh goodness, notation, JavaScript object notation. So basically, it's a data interchange format. It is not specific to any one programming language, so it's very popular. And as you can see from this notepad result here, it's easy to read as a human. There are actual words that we can look at,
well,
and then,
I'm not sure I'd throw the word easy to read. What that paragraph?
It's not the hardest thing to read. How about that?
Okay, fair enough.
So I have highlighted up here, you can see it says created at Saturday, January 9th, and so on. We're going to follow that and see where it ends up, so that we can kind of see how we get from the Twitter API to the spreadsheet. So if anyone who is watching this is, they see a flaw in my methodology, please let me know. Please put a comment in the outline, so that I can know, because I want it to be right. All right, so here we are. The things that are grayed out are things that I have to scrub later, because I want to make sure everything is de-identified. And with a project being, really this small, this piece of it, it doesn't make sense to build something to do it automatically. So I will scrape it, or not scrape it, but I will de-identify it, anonymize it as needed, delete things, out of the final results as needed. I'm keeping them, but they're hidden. And that way everything is properly de-identified. Because honestly, these pieces that I've had to cover up, they mostly don't matter to me at all. All right, so there's our JSON file, and now we would like to turn that into something a little bit easier to read. So we turn it into a CSV file, and you can do that online. There's a lot of places that will do that for free. So you just type in JSON to CSV file converter, and there you go. And they all work pretty much the same way. So it gives you basically a spreadsheet, and this one had 225 populated columns.
Can you explain why you did that, though?
Well, eventually I'd like to be able to look at everything categorically, look at the same information from each tweet, and analyze the same information. And we'll actually see, there's another slide that looks even better. It is not an unusual thing to convert a JSON file to a CSV file.
No, I wasn't suggesting it was. I'm trying to explain to the irregular audience why you would do that. And they might wonder, well, does that create problems? And you're just basically converting formats as well.
Yeah, we're just converting formats. So if we go back, see where my highlight is, Saturday, January 9th, 2108, see it? That is the same information that we had here on the JSON file. So basically, if we were to read across this this line, and actually it goes well beyond what I cut off here, the notepad file, it's very, very large. Basically, it's all the same information in a different format. So, here it's all lines. And then if we convert it to a CSV file, we get nice, neat columns. And it's categorized by created at or ID or full text, so that we can look at the data more easily and categorize it more easily. Did that make sense?
It did.
It did. Okay. Wow. Good deal. Nobody's asleep yet, right? Everybody's awake? Still awake? Yeah.
I've been sleeping, but that's fine. It's close.
Well, that's okay. It's been a long day, right? All right. So I need to analyze 5 columns out of this 225 populated columns. And
now here's a question: why are there 225 populated columns when you're only going to pull 10? I think it was 100. You said, right?
Well, it's going to be 100 rows, right?
So it's 100 rows. Now, why am I seeing deleted rows on there?
Well, because if I think it has to do with there being a retweet of something, or if it's just an image, it will create these blank spaces, but they're very easy to get rid of.
No, I'm just trying to figure out, does it create bias in some way? That's
I don't believe it does. I looked to see why there was a blank file, and I asked an expert why there was a blank, why are there blank rows here? Are we missing some data? I was concerned about that. No, it just creates an extra line. Okay. So as far as I am aware,
just to be clear, the expert is well paid and well compensated, correct?
Of course.
There you go.
Of course. All right, so there's our CSV file, and now I want to analyze it and make it pretty. So here it is. This is the Excel file for its audience, and I actually had to go ahead and add this line for the Saturday, January 9th. I ended up filtering it out. I didn't get rid of it. I filtered it out because, as you can see, it really has nothing to do with the actual drug. And there were some comments like that seemed to be either spam or completely unrelated. There were, some that discussed the commercial for the drug in a way that was not really helpful from a patient standpoint. There was is it Sky Rizzy? One of them, people just absolutely loved the theme song, but I'm not sure if they were speaking ironically or not. It is catchy, kind of.
Wait, theme song for what?
I think it was Sky Rizzy.
No, I got that part, but what is Sky Rizzy? Is that a singer?
No, it's a drug.
Oh, Skyrizi is the drug.
Well, it's a biologic, actually. So technically, it's a therapeutic biologic, which may or may not be a drug, but it's certainly a biologic. Okay. See, you really just need to get on Twitter and start checking out these brands. You got to be hip.
I feel really bad as a pharmacist that I'd never heard of Skyrizi. That sounds like a singer.
It kind of does. It's a singer, or it sounds like a car. It was Saturn, the Saturn Sky. So now it's the Saturn Sky Rizzy.
There you go. Okay.
With turbo power. Right. Okay. So I took the file, I created a blank worksheet, I copied and pasted the appropriate columns into the new worksheet, so I didn't have the remnants of 225 columns to deal with, because that can create problems in the file. And then I added some additional columns, analyzed and de-identified, and we can go through that in the outline. But I wanted to, sort of show a picture of how we get from I sent a call, I sent an API call, and now I have an Excel file. And as far as I'm aware, this is the appropriate way to do it. So if anyone, knows differently or has a different idea for how I can get this information more easily or more efficiently or without, with less bias, I would love to hear. Sure. All right, so I'm going to stop sharing this one and go back to the outline. And I've lost my window. There you are. All right, sharing screen, the outline that we've all been waiting to look at again. Okay, you can see the outline. That's good. All right, so this part of the outline really just kind of reiterates what I talked about. The query is conducted in Postman, which is a free web services tool. You go to postman.com, you sign up, you create your little query, off you go. A developer account is actually not difficult to get, and actually creating a call is also not very difficult. So, if people are thinking, gosh, I'd like to do this. It's actually not that hard. You just have to explain to the people of Twitter what you're intending to do with this data that you're going to be gathering, and they have to approve it. And they did, so that was great.
What did you say you were going to do?
What did I say I was going to do? Oh, I explained the nature of the project, that I was doing a graduate project on the nature of trust between patients and pharmaceutical companies, and for part of that, I needed to, collect discussions that had to do with a particular list of brand names. I explained that it was not actually going to be for commercial use, but for academic use. Basically just explaining that, and how the data would be manipulated, that basically the data were not going to be manipulated very much. It wasn't going to be turning this into some other tool, which I think is what they're most concerned about. Obviously they don't want people publishing full lists of this stuff online because it is traceable if you don't de-identify. But it did not seem to be a problem. There were no questions, no issues. Approval was granted, and off I went.
Got it. Okay.
So that was actually pretty easy. But again, if you want a larger data set, or if you need different information, then perhaps this isn't the best way to go. I think if you did an API call on a free account and you needed a large data set, you'd probably drive yourself crazy. So it might be better to find someone who has a data set that you could use.
Got it.
If you're just sort of doing it on your own without really a budget.
Okay, so we've now got this data for a 7-day span, up to 100 different rows. Mm-hmm. Then conducted a query in Postman. Now, what is Postman? Yep. Why is it relevant?
Okay, Postman was actually at the beginning. So this is really just explaining the actual steps that I took in order to send out the call, right? Send out the query and get a response.
Sure.
So, you kind of need Postman in order to frame the query, because you can't just type this into the box at the top of your browser and have something happen. Not for this.
Got it.
You can if you're Googling, incidentally, but not for this.
Right.
So, the example of the query, truncated has to be false, and this was discovered by truncating it the first time and realizing the full text was just gone, and that did not help me. If you didn't need to look at full text, I think it would be probably fine to do. So again, 7 days worth, or the last 100 tweets. For some brands, it got 100 for 1 day, and for other brands, it took the 7 days and we didn't even get 100. So there's a lot of variation. And then I talked about converting it, copying and pasting, and which fields I needed to copy.
For you.
Yeah.
The brands that you got 100 in 1 day, were they newer or older?
I'm trying.
The reason I'm asking
that question. It wasn't actually. Yeah, go ahead.
The reason I'm asking the question is, does it maybe tie to if it's? I'm making this one way or the other, but if it's newer, maybe you trust it less, only because you've not had enough experience with it. And if it's older, alternatively, you could trust that less because you've now had experience with it.
I had it. I tried it. I hate it. Bye. No.
Right.
It's possible, and I'm trying to remember. I should have looked up all of them, because you might ask me this question, and I should be ready for it. I want to say that Humira had a lot, and obviously Humira is a much older drug. It has a lot of indications, or much older biologic. Sorry, technically, sort of not a drug, but sort of a drug.
For the purpose of this, we're going to call biologics any therapeutic product as a drug.
As a drug. Well, some people are sticklers about this.
I 100% agree with them. But I think for the purposes of this,
a pharmaceutical product.
There you go.
There we go. So Humira, I think, had a lot, but it was not. Well, you know what? Now that I think about it, I think some of the newer ones had fewer tweets, and the older ones had more. But you could also ask yourself, does it have to do with the number of indications? I mean, that makes your patient base a lot bigger.
True. Fair enough.
And sometimes it was really just about things like commercials. So many comments about the commercials. It was actually very entertaining. Not relevant, necessarily, unless they were talking about the commercial in terms of something that is actually related to the drug the commercial is for. but entertaining nonetheless.
Sure.
All right, so data cleanup and whatnot. I de-identified. I found someone who had actually posted something on GitHub that had to do with de-identifying Twitter data for a mental health study. And so I kind of followed what he had done in terms of, this makes sense. I just want to remove anything that can be immediately traced back to a particular user. And obviously, he did not think that hashtags were part of that. So I went ahead and left the hashtags in, but there actually weren't that many. Not that many tweets that had hashtags. So I guess people who tweet about pharmaceutical brands are not really, really big into hashtags. Who knew? So I did create a couple of new columns. I had to identify the personal tweets. So I pulled the user information into my spreadsheet. I looked at it and I verified whether it was a personal tweet or not a personal tweet, because I believed that including business-related tweets could introduce bias, could confound. Certainly, it would affect the sentiment. Is it trustworthy or not trustworthy? And a lot of the business tweets had to do with, say, the stock market, actually, and not the drug, or it had to do with a new clinical study result, but it really didn't talk about it other than just retweeting.
Yeah.
So I wanted to remove those. I really wanted to look at actual patients who might be using this drug or had been using it or were familiar with it in some way. So that's why I looked at it and I then removed it. I just marked whether it was personal or not. And I do have the source files, but I did not want to keep anything identifying. So yep, I was able to get rid of the data once it was, verified to be individual or not. Then I talked about some of the other things that I removed, the at mentions. I added a column for whether it was spam, spam or not, and whether or not it was unrelated to use of the drug brand or familiarity with the drug brand, and filtered those out as well. Tweets that were not related would have been things like content that had to do with an ad, a politician, jokes. Some of these had a lot of jokes, or other information that didn't really include a mention of the brand with regard to treatment, pricing, patient access, public trust, etc. Then I performed a manual sentiment analysis.
Angela, you've got all of that written out, right? What that etc. includes, like how you decide.
Yes, I do.
Okay, cool.
Yep, I do. So the sentiment analysis, I'll just go over it really quickly. I think we're getting a little bit short on time, but I want to push through. Basically, I went back to the model of trust and I asked, how can I look at trust in terms of a tweet? So, for example, perception that a brand has behaved altruistically, that would be benevolence. Perception that a brand is approachable, warm, or sympathetic, also benevolence. Attunement, perception that the brand is aware of a patient need.
But quick question, how are you identifying if that perception is present, though? Unless they use those terms, which I expect they wouldn't.
That is a good question. And let me... all right. I actually did have one more slide in that deck that we could look at that might explain better. Basically, okay, so in the case of...
I'm reminded of Kramer right now where I just where he was playing movie phone, and then he goes, let me just tell you what movie he's playing. So you could bring up a slide, or you could just tell me what the slide says.
I'll just tell you what the slide says.
Fair
it was pretty though. It's a beautiful slide. I can't believe I forgot about it, but I was so excited about the spreadsheet, the spreadsheet and the outline. Oh my goodness, it's nerd heaven. So a lot of it really does come down to, you look at the tweet and then you say, well, what is the sentiment? And I went and actually, wrote these down. So if you go through the outline, you can see there's some for integrity, there's some for competence, there's some for attunement. And distrusting or showing a lack of trust, I don't really discuss in the model because I think that may actually be sort of a corollary. And I really didn't want to get into it too much.
But I want to go back. You didn't explain the answer to the question, how do you address perception?
How do you address perception? Well, it is a good question. And actually, I spent a while trying to think about it. I can't know someone else's thought
Sure.
when they're writing this,
Yeah.
but I have to react in the way that I would if I assume that I am a reasonable person
Okay.
and I am looking at this as a reasonable person might. So, for example, I'm going to read one of these
Sure.
that I was going to show you. It's a tweet that was a personal tweet, and I've labeled it as distrusting.
Okay.
Um,
So
it is
let's see what the standard you have for distrusting. So let's go to distrust
okay.
first.
All right. Well, here we go. All right. So distrusting is either going to be the opposite of any of these trust-related behaviors. For example, a perception that the brand has failed to keep its promise,
Okay.
experiencing an intolerable side effect, believing the brand has failed to communicate necessary information. These are all.
Hold on. Why are we experiencing intolerable side effects? Why is that a lack of trust? Is that in the
Well,
brand? Is that in the drug, or is that just expected sometimes?
well, if it's expected and tolerable, then it wouldn't really affect trust, right? So let me look here. I did
Let's
add
also
it to
call it
my.
distrustful. I mean, if you go down,
I
it's
know, just a second. I know, Darshan. Um, let me look. I actually did add it because I knew that it was important to include this. So, is it attunement? Has heard the patient. I should have highlighted this really quickly, so I'm sorry. Um, all right, it is in here somewhere. Something. Oh yes, predictability of interaction. That is attunement. Predictability of interaction includes taking a pharmaceutical therapy with no unexpected or intolerable adverse effects. Predictability. Do you agree?
hold on. It feels circular because you said distrust is goes to whether they're unexpected or intolerable adverse
Right.
events.
But that is based on the fact that in order to be trusting, we have to have a predictable interaction. So if you take drug X for a year and you have side effects, but they're not unexpected, or side effects and they're not intolerable, it's probably not going to stop you from taking it. It's probably not going to stop you from thinking it works. It's probably not going to stop you from recommending it to other people. Right? So
Let's
that
agree to all those statements, but
mm,
does that affect trust?
well, I think it would. I think it does. Of course, being able to quantify that is a little bit different.
Yeah.
So, in terms of this analysis, and you'll see in just a second. So anything that is the opposite of something in the list of what constitutes a trusting interaction or a report of a trusting interaction or perception that there is trust, that would be either distrust or lack of trust. We're not sure which. I used the term distrusting or neutral just because it made it easier. I think if I were to nitpick it to death and do, well, this is not trusting, but this is distrusting, that would kind of go beyond the scope of the project. So we've got, lack of any of the behaviors from the trusting section or the opposite behavior. But also in a healthcare context, distrust has to do with the perception of deception, exploitation, or discrimination.
So it requires both conditions?
It does not require both. It can be either.
Okay.
It can be either. And that was based on a study that was done on people who had participated in clinical research studies.
Okay.
And their perception of their treatment. So I felt safe enough putting that in because I felt like just having the opposite of a trust-related behavior may not be enough.
Okay.
And it's neutral if it is like none of the above or there's not enough context. So this tweet that I'll read off real quick says, it's not about justifying prices because insulin is life-saving and therefore has limitless value. It's about cutting bloat by paying for the life-saving meds, not crap like Jardiance and the 85th patent extension of Lantus that do nothing different but cost more because they're new. Now, I labeled that as distrusting. And I labeled it, when I explained why I labeled it distrusting, I wrote, that the use of the pejorative term crap to describe a brand suggests that the user believes the brand to be of low quality, which would suggest a lack of competence or integrity, or low utility, which would be, actually, I cut that off, so that did not help. Where'd it go? I'm sorry, I lost my stuff.
You're okay.
There we go. And that would also be considered distrusting. And I believe that was a lack of attunement to offer something that the patient has no use for.
Fair enough. Okay.
So, and that is an example of, how I chose distrusting for a tweet. And, perhaps I should go in and explain the methodology a little bit more.
Yeah, maybe beef that up a little bit, just
okay.
So you have that in there.
I'll make a note to do that. But that's where we are. So once the spreadsheet is done, it actually was a matter of assigning points, which I did discuss in the outline, and then basically just adding them up and averaging them.
Talk to me about how you assign points.
How do I assign points? So a trusting tweet receives a score of 1.
Okay.
A distrusting or not trusting tweet receives a score of -1, and a neutral is a 0.
Okay. How do you define neutral?
Neutral is something for which there is...
facts without additional context. Got it.
Yeah, it needs additional context. And again, in the slide that I had ready, it was in there too, so that you could see it. Right. And then it averaged out. And when I applied the numbering system, that was only for tweets that had been filtered to remove anything that was spam or not related to the drug or not a personal tweet. So it can be very small. And in the case of Jardiance, it actually was like 4 or 5 total.
So would something like I am using Jardiance be considered trustworthy because they're basically making a pitch for it? Mm-hmm. Or is it considered neutral because it's still a fact without additional context?
That is actually the hardest one for me, is where you've acknowledged that you are, in fact, a patient who is using this particular therapy, but there's no context. So I would be more likely to ascribe that to being neutral.
Interesting.
Because I feel like in order to be trusting, it would need to be something more like, you should have your doctor prescribe Jardiance, or Jardiance really works for me. And there actually was a tweet that I ascribed to being neutral. And let me bring that up really quickly so I can see it. And it basically, I'll just read it out real quick. It says, unless you have diabetes, period. Drinking a lot of wine if you have diabetes or consuming anything that raises your blood glucose can lead to overgrowth of yeast in the vaginal area and elsewhere. Also taking Jardiance, or this one I don't know how to pronounce, Farxiga?
Okay.
Farxiga, does it for me. And actually there was a much longer and somewhat interesting discussion of, fungal overgrowth.
Sure.
And apparently it's the people are really kind of disturbed by the commercials. But that one was neutral because I recognize that the side effects are mentioned, but are they unexpected side effects? Are they expected side effects? Are they intolerable? We don't know. So since I don't know if they're intolerable, I don't know if they stopped the patient from taking it, but I also don't know that the patient continued to take it, so it's neutral.
I think what you want to do is recognize that is a potential bias you are introducing to the system.
Sure.
That's in your list of things to point out. So yeah.
Yep. I will have to add that to limitations for sure if I already haven't.
Yeah. So the next one's going to be brand website analysis?
Yes, the next one will be brand website analysis, and that actually, if we can get through it all, which I think we might be able to, will be sort of the last one in the series, and then it will sort of be maintenance after that.
Okay, so we're going to do, is that for today, or are you thinking you want to do that next time?
Oh, we'll do that next time.
Got it.
It's pretty large, so I think we'll get it into one go next time.
Perfect. And if they want to reach you or have questions or comments, they'd go to tinyurl.com/modeloftrust.
Yep. Put in a comment there, or if you'd like to email me, it's awagner mail.usciences.edu. But just leaving a comment on the document, should be fine too. That might be easier to remember.
Awesome. Thank you again, Angela. This was wonderful.
Thank you so much.
Take care.
You too.